4 warning signs that may indicate high blood pressure. Also known as hypertension, high blood pressure is a common condition that occurs when the force of your blood against the artery walls is too high. Over time, this may lead to health complications such as heart disease. In general, hypertension is a silent killer as a person may not show symptoms until years or decades later. At this point, the condition becomes severe enough to the point that the signs become more obvious. Here are some symptoms that may indicate high blood pressure. Number 1. Blood spots in the eyes. Blood spots are more common in people with diabetes or hypertension. None of these conditions cause blood spots. Floaters in the eyes are also not associated with high blood pressure. However, your ophthalmologist may be able to detect damage to the optic nerve caused by untreated high blood pressure. Number 2. Dizziness. Dizziness can be a side effect of some blood pressure medications, but it is not a result of hypertension. That does not mean you should ignore dizziness, especially if it's sudden. Loss of balance or coordination, trouble walking, and sudden dizziness are signs of a stroke, and hypertension is a leading risk factor for stroke. Number 3. Headaches and nosebleeds. In most cases, hypertension does not cause headaches or nosebleeds, except in cases of hypertensive crisis. Hypertensive crisis is defined as a medical emergency when your blood pressure is 180 over 120 millimeters of mercury or higher. If your blood pressure is unusually high and you experience a headache or nosebleed, wait 5 minutes before measuring your blood pressure. If the reading is at 180 over 120 millimeters of mercury or higher, please call your local emergency hotline. If you are unwell and suffering severe headaches or nosebleeds, consult your doctor as they could be signs of other conditions. Number 4. Chest pains. Chest pains could be a symptom of a hypertensive crisis. Hypertensive crisis can lead to a stroke, and having a blood pressure of 180 millimeters of mercury or a bottom of 120 millimeters of mercury or higher can harm your blood vessels. In this case, seek immediate medical help. Some patients report vomiting and feelings of nausea. It is also possible to develop anxiety along with shortness of breath. In severe cases, hypertension can cause seizures and unresponsiveness. To manage and prevent high blood pressure, it is recommended to eat a heart-healthy diet, reduce your salt intake, maintain a healthy weight, increase your physical activity, limit alcohol intake, and monitor your blood pressure. Monitoring helps you keep track of your blood pressure. In the case of normal readings, don't stop or change your medications or diet without consulting your doctor.